be on silent now, hopefully.
I'm just expecting a call from the Avenue about an ultrasound scan.
Okay.
So yeah.
So yeah, it was back in March time, wasn't it, when you last came?
Yeah, I think it was. Yeah.
So how have things been doing since then?
In terms of the pelvic floor exercises, I started off really well with them. And then unfortunately, my symptoms of what I believe are a severe vaginal infection got really bad, and it spread to my bladder. So I've been on like a lot of different antibiotics. I've been on clindamycin, topical cream for BB. Then I've been on most recently coamoxiclav and trimethoprim prescribed by a private doctor. And then here before that, I was prescribed metronidazole with coamoxiclav. So that was a 2-week course. Before that, trimethoprim from the GP. Before that, I've just been basically on like so many different antibiotics, and they've given me quite bad side effects. I think I'm allergic to penicillin, so I've had to stop those. What was going to be a 3-month course of coamoxiclav and trimethoprim because I think I was allergic. But as far as the pelvic floor exercises go, I have been doing them, and I do them. It's just that I am off. Like for example, today I haven't slept since the last night I've slept, only for a few hours because I could feel the sleep dwindling. Was last Wednesday evening. I slept last Wednesday evening. I haven't slept since last Thursday, and that just seems to happen. I go through peaks and troughs where I sleep really well some days for about maybe 6 days, and then suddenly something will happen and I will just literally completely stop, or the sleep will get less and less and less, and then it will feel like I wake up and I'm like, have I slept, have I not? And then it just stops. It just stops, and it's like there's no rest, there's no sleep, and it's pretty awful. But I've got £18 left in my bank account now until I get my universal credit on the 23rd, and I've just spent £95. I got here early today, I was here at 11 a.m. and I spent £95 on a private vaginal test with Focus Laboratories. The reason I did that is because that's actually reasonable for a home test, and I just found it today and I thought, oh my gosh, bingo, because I spent £140 on a urine culture with them in January, and I've used a few different companies now, and that urine culture results, it's Dr. Anderson, she's a female doctor. Again, I only found out today that she's a female. I thought Dr. Anderson was a male, but she's a female, and in her letter, she wrote in January that she would recommend that I'm given intravenous antibiotics, a combination of antibiotics for Klebsiella pseudomonas and Gardnerella. So Klebsiella pseudomonas and Enterococcus. And I haven't had the IV, but then I went and did a different private health test with a different provider, and they didn't suggest IV antibiotics, but they found the bacteria was Gardnerella, which interestingly enough hadn't been found in the initial test from this female doctor. They didn't find Klebsiella, which suggests that's now gone, but they did find Enterococcus and Gardnerella at a very high threshold, and then Pepton Felix was also above the threshold. So it's just been awful. This whole last year has been so awful, which is just so strange because like last January, mentally I really stepped up. Like I became a lot better mentally because I was able to sleep for the first time in 2 years after giving birth. But then shortly after that, literally within about I'd say so the start about 5 months after I woke up from what felt like a 2-year walking coma, suddenly my body started deteriorating. My whole pelvic area just literally started deteriorating. And medically, if I was a scientist or a doctor, I would be fascinated by what's gone on with my mind and my body, because honestly, it's been like such a journey. But it's just a case for me of trying to resolve things as best as I can. I've just bought this. I haven't actually, all of the tests I've paid for, apart from the one in November, have been urine sample culture tests, and I haven't actually set up any swabs. So this one that's going to arrive in a few days is going to be a vaginal test. It's called an extended vaginal testing. So it's going to test for like lactobacilli, it's going to test for infections, pathogenic bacteria, and I'm so glad I found it, because I didn't even know it existed. I thought they only did the urine ones on this site, but they don't. So I've got no money now until next week, but I am going to have, by the time I get paid, I will have the results back from this test, hopefully. And you know, you have to do what you have to do sometimes. But as for the pelvic floor exercises, I would be interested to see if there's been any improvement, because I have definitely been doing them, especially shortly after our last appointment. It was unbelievable. I don't know what changed, but it was unbelievable. Like, for the first 2 months after the last appointment, I was doing them obsessively. I was literally doing them obsessively. And like, I was sleeping as well. I've been through phases where I've been sleeping really well and then it just stops. But yeah, so I know you're pelvic floor physio as opposed to, I think, as opposed to being a general urogynecologist. So I don't know if that, am I right in saying that you're a nurse who specialises in pelvic floor?
We're physio.
Physio, yeah. This is the physio pelvic floor department. Yeah. So another thing to mention on that front is I have been doing the Kegels. I've also been doing them for my rear end, because I was given a diagnosis of hypercontractility, which basically means that my rectum doesn't contract like it should, which can cause issues with incontinence and stuff. So I've been doing those too. Basically just means like pulling in from your lower back. As far as my pelvic floor though, I've also joined a gym 7 months ago, David Lloyd Centre, and I have been going there a lot. And yeah, from a pelvic floor perspective, one thing I'm actually quite worried about is that, and I must say, I said this to my ex-boyfriend in what would have been 2024, when I last saw him before we just stopped contact. I was at his in London, and I remember saying to him, I literally feel like my pelvic floor is like just deteriorating, like it has no strength, it's just dying. And that's what it feels like at the moment sometimes. It feels like I've got like loads of infections everywhere, loads of inflammation all around my bowel, my bladder, my urethra, my vagina, and then it feels like there's just loads of pathogenic material that shouldn't be there. No matter how many antibiotics I've been on, and thrush probably, and then it feels like I go to the gym because I'm trying to build up the strength, but it kind of sometimes causes leakage, and also it feels like, especially if I do the ones where like there's a machine where you put the weight across here and then you sort of go like this with the weight, and it's fantastic because it's working my glutes. But then the pressure it's putting on my lower abdomen, I've always had a feeling of tenderness in my lower abdomen, and I don't quite know what's causing it, whether it's SIBO, I was prescribed antibiotics for SIBO, whether it's something to do with an infection or this cystitis, chronic cystitis I've had for years. I don't know, but yeah, from a pelvic floor perspective, I do feel like there is something that's not quite working very well for me with the pelvic floor. But on the same note, I have been doing a lot of pelvic floor exercises. So I do think that like I'm doing a lot of floor work with the yoga ball, and I'm doing a lot of sit-ups, and I'm doing a lot of abdominal work. And the only thing I haven't really been doing, I've just stopped doing really in the last 5 months actually, is the yoga, and I stopped doing all exercise classes just because I know they're absolutely fantastic for my pelvic floor. But with this severe, with all these severe pancreatic / gastrointestinal / renal / gynecological, urological issues, especially with the urge incontinence and the inflammation in my lower organs, in my lower abdominal organs, chronic inflammation, it's really difficult for me to do the classes because it's like I feel very self-conscious and I feel always just extremely uncomfortable in my body. I'm really, really uncomfortable. And I'm like taking the cystitis sachets now. Like I remembered to buy them a couple of days ago, so I'm taking those, but I've got memory problems, so sometimes I forget, and then days go by I haven't taken them and things get really, really, really bad. I mean, I would say I've got like a chronic illness now. I was in a pharmacy the other day and he said, but if you've been having these symptoms for over a year, that's not an infection, that's a chronic illness. And I think it is a chronic illness, but I think it's a treatable chronic illness. But it needs to be treated like an acute infection. I need a prescription because of one of the private tests. One of the medications I think would really help me that I was given in this second report from Nick Parkinson, who's a private doctor, is a prescription for clindamycin hydrochloride because I'm allergic to penicillin. So I've just been on coamoxiclav and trimethoprim. I shouldn't have been on them. I'm allergic to penicillin. So they said if you can't take the coamoxiclav or the amoxicillin, which is the same group, then you should try clindamycin hydrochloride. So that's something I really want to take, but at the same time I kind of don't want to take it. I'm going to try and get it today from the same day emergency care, I think. But whether I should take it before doing this private vaginal test, I'm not sure, because it could affect the bacteria that comes up in the swab. But then at the same time, like the thought of getting through the next, like it'll be sent off in the post tomorrow, meaning it will probably arrive on what day is it? Today's Monday, so it'll probably arrive on like Thursday. And the thought of getting through to Thursday right now is just really, really not great. It really isn't great, the thought of having to get through. So I think I just need to find someone who will prescribe me clindamycin hydrochloride for the Gardnerella, because at least if I know that's gone, that's at least something that will mean that it will help. It will mean that I don't have that ED, which is something I've struggled with for years. So.
Okay. And so what were you kind of expecting from coming today, or kind of hoping for?
Well, from a pelvic floor perspective, just I guess maybe like a reassessment, or for you to tell me that to give me some exercises I could do at home or in the gym, and to just assess my pelvic floor and how it's functioning. That would be really helpful, because it's like, as a solo parent, as a solo mum, I'm balancing everything myself alone. So it's kind of like I'm trying to access private medical care whilst trying to maintain my contact with the NHS, that I'm lucky enough to have been offered this support from the NHS, whilst also trying to like eat food that's healthy and nutritious and not junk, and then exercise, and then trying to sleep as well and manage my stress levels, and then deal with like various different like court cases that I'm trying to manage, and then trying to get back into an employment and earn an income and manage my finances. And like honestly, every single day I'm close to a breakdown, because it's like there's just so much. But if there's one thing I can do, which is like, whilst I'm still struggling with an infection and obesity, there's always going to be something at the moment, at least. But it's like with weight loss, you don't have to just focus on cardio. You can do the weightlifting at the same time. You can build muscle whilst you're shedding fat. So it's the same thing. You can build your pelvic floor whilst managing 1,000,001 other things.
Yeah. Okay. Should I
Yeah.
re-examine you then, and we can kind of compare it to last time and see where things are at?
Yeah,
or what
if you
to do
could,
from
that
here?
would be great, just to see if there has been any improvement or if you notice anything. I wasn't going to. I did, like I told you in the last appointment, I have been using those DAYE Women's Health Company little. They're not pessaries, they're little circular pills that contain lactobacilli, and you insert them like a pessary. And I did put one in yesterday, so you might see some remnants of that. But
Okay. I'll give you a minute. If you take your bottom half off,
Yeah,
and
that's
then I'll
fine.
just go grab a chaperone and then I'll come
Okay.
back in. Okay.
yeah, that's fine. Am I right to come back in? Yeah. I don't know if I'm like far enough up this bed or whether I need to move further back. Or... Are you comfortable there, or do you want to move us a little bit? Maybe a bit. Yeah, thank you. So it'll be exactly the same as before, and it'll be painful and comfortable for you. Okay. If you want me to stop at any point, just let me know, okay? Okay. Can I get you to bend your knees up for me? So if I just check your sensation from the outside, does that feel similar to that? Yeah. And does that feel similar to that? Yeah. I'm just going to have a look on the outside. I've had quite a lot of like pain around it. I don't know why, it seems to be quite inflamed. I'm trying to work out why that is. It feels sore. Yeah, I have been applying the cream on it. It's like a pseudo cream type thing that I've been given a few times from like nurses and stuff. It's like the general inflammation. Okay, can you squeeze your pelvic floor for me? Yeah. And relax. Can you do a cough for me? And can you push down as if you're going through your bowels? And relax. Are you alright for me to carry on? Yeah, that's fine. You're a little bit cold. Okay. That'll feel okay? Yeah. Yeah. Can I get you to squeeze your pelvic floor again for me? Yeah. And relax. Okay. Good. And again, squeeze. Okay. And relax. Okay. And then this time, if you just try and think about squeezing on your back passage for me. So if you imagine there's a piece of spaghetti at your back passage and you want to try and suck the spaghetti up your bum. Okay. Good. And relax. Perfect. And then can you do that exact same squeeze again, but can you squeeze and keep hold of it for me this time? Yeah. And relax. Okay. Good. And again, squeeze. Let's get you up. Yep. And relax. Okay. And squeeze again. I've got something crawling on my head. Sorry, I felt like an ant or something. I think there might be a little bug. Oh no. Okay.
You've got it.
Good. Sorry. And then you squeeze one of your back passage again for me. Relax. Yeah. And again. And relax. And again, squeeze. And relax. And again. And relax. And again, squeeze. And relax. Good. Okay. And then can you do some shorter squeezes for me? So if you just hold it for a second and then let go. Okay. Is this squeezing the pelvic floor muscles or the back passage muscles? Just squeeze your back passage like that. Oh, okay. They're probably quite tired because I haven't slept in quite a few days. One more and relax. And then can you do a cough for me? And then this time can you squeeze your pelvic floor, keep hold of it and then cough. Perfect, okay. That's it, that's all I need to do. Okay. So we'll lower you down. Tissue, then tissue. Okay, thank you. I'll let you get dressed and sorted and then we can have a chat first when you're dressed. Alright. Okay, yeah, that's fine.
Stay well.
Thank you. Yeah, yeah.
So, in terms of your pelvic floor, I would say that it is a bit better than before. Also, you can hold longer with it, you can do more repetitions and more kind of quick squeezes. The only thing I'd probably say is, so when I was getting you to kind of squeeze more from your back passage, it's just because sometimes you can get a stronger squeeze happening. So you are still engaging the whole of your pelvic floor, but sometimes just trying to visualize or kind of think about squeezing more from the back, you can get a better contraction happening.
Okay.
So you were getting a better squeeze happening when you're thinking more about squeezing from your back passage rather than generally kind of like squeezing the whole of your pelvic floor.
Okay.
So
that makes sense.
what I would tweak doing is just trying to concentrate, maybe squeezing more from the back and then almost gently kind of zipping forward to the front. As a focus, kind of starting from the back when you're squeezing your pelvic floor.
That sounds like a good idea.
And I would try and see if you can squeeze and hold for 10 seconds, and I can write this down for you. And I would try and do 7 of those in a row, and then 10 shorter quick squeezes.
Okay, thank you. Yeah, that would be great to have a new exercise regimen.
But it feels like the muscle, before there was a little bit of increased like tension in them, whereas it feels like they're relaxing better now, and that's better, which is good. So sometimes when that squeeze gets a bit better, you can almost just sometimes a little bit easier to feel that letting go, and it can sometimes switch off a bit better. So that looks like it's better, which is good.
That's
so maybe
good.
the things you've been doing from before kind of just help to
let
to
it
switch off a little bit.
Yeah.
And now we want to kind of focus more on doing the.
Yeah, I remember you put
Yeah.
quite an emphasis on trying to manage stress
Yeah.
to decrease the tension in the pelvic floor, and
Yeah.
I think once this infection's treated, it will the stress on my body will be a lot less as well, and hopefully that will mean that there's less tension on palpation.
Mm-hmm.
I don't actually know what palpation means, but when I like a few years ago in North Leeds, I saw a women's health osteopath, and she wrote me an email afterwards and said the phrase "tender upon palpation."
Just touching.
Oh, I see. Yeah. So that was then, and in fact, I told you already. She was unable to do the pelvic floor assessment because my episiotomy scars were really painful. So yeah, but obviously I've come on a long way since then. So it's good that you've seen an improvement anyway. That's really reassuring.
Yeah. And I think, it's just trying to kind of keep up with this now, and then maybe giving it another couple of months, and with the other tests and things that you're having, maybe then seeing where you're at in another 2 or 3 months time, if you're happy to kind of
absolutely.
review things.
That would be great, because hopefully next time I come in I won't have any like pelvic infections, and I'll have completely balanced my microbiome. But most importantly, the gymming will be, I'll have been a member of the gym for about a year at that point, so and if I'm doing the clenching, the pelvic floor exercises every day, then you should hopefully see a real improvement, as well as the stress management. I do still need to work on my stress management. I think I need to get more social support and also emotional support, and I also need to, although I do go into the sauna to relax, and I swim to relax, my TV has been off for 6 months, so I can't relax in front of the TV, and I've just got other added stresses, that I need to deal with, like my weight, like my financial situation, my general health situation, my family situation, my employment situation, there's like the stresses need to be managed. So hopefully by the time you next see me, I'll be both physically and mentally, pelvic floor wise, it will all be looking much, and we'll be feeling and looking and assessing and measuring as better than it is today, and well, definitely since the last time as well.
Yeah, and I think like say, really having that emphasis on managing stress, or relaxation, or just deep breathing, and kind of the stretches that we went through last time. I could still continue with all of that, and make it part of your lifestyle and part of your routine. Because it won't just impact your pelvic floor; it has impact for kind of the rest of your body.
Right. So I need to get back into the yoga and Pilates at the gym, because I've stopped doing those classes. That would be great for relaxing my pelvic floor, and the stretching as well. I do a fair bit of stretching, but I could, if I did the yoga and Pilates, that would increase that even more. So that's definitely a measurable goal I can set before the next appointment.
No, that sounds good. And then I've written your exercises on there for you.
Oh, thank you.
Okay.
Yeah, thank you. That's great. Oh, and so this should help my bladder as well, because Dr. Kazan, who's my consultant in neurology, he said he might want to prescribe you exercises for an overactive bladder as well. So I think that the pelvic floor exercises will help if I do have an overactive bladder. Then they'll help with that. So that would be good.
Doing should help from that point of view as well.
I hope it will do. Yeah, thank you.